The type of fluid to give, I think, requires a little bit of knowledge of the underlying disease process, because the treatment of a patient with acute bleeding is very different from the patient with an acute infection that's suffering from systemic complications of that infection, which might be very different from an animal who's dehydrated with heart failure and requiring some volume but probably can't take the amount of sodium load that the animal that really needs replacement fluids might actually benefit from. So I think types of fluids, there's been a gazillion dollars worth of research into what's the best type of fluid for resuscitation of the basic shock patient. More and more we're realizing that probably a balanced electrolyte fluid is better than an unbalanced electrolyte fluid, except maybe in specific circumstances where an unbalanced fluid such as 0.9% saline that has a very high chloride level might be beneficial. So if they have a hypochloremic metabolic alkalosis and you're not able to immediately fix that with maybe surgery for an obstruction, then that might be a fluid that would benefit that patient in the short term. But for the majority of patients, an isotonic balanced crystalloid is going to serve them from an acid base and electrolyte perspective a little bit better because it has a more physiologically balanced amount of electrolytes and potentially helps with pH imbalances as well.